Mic 3, perform first aid to restore breathing and or pulse. Step 1, approach the casualty and check for responsiveness.
Hey, are you okay?
Casualty is unresponsive. Direct a specific bystander to call for medical personnel.
Get medical personnel.
Direct another specific bystander to retrieve an automated external defibrillator.
Get a defibrillator.
Step 2, roll the casualty onto his or her back. Kneel beside the casualty. Raise the near arm and straighten it out above the head. Adjust the legs so they are together and straight or nearly straight. Place one hand on the back of the casualty's head and neck. Grasp the casualty under the arm with one free hand. Pull steadily and evenly toward yourself, keeping the head and neck in line with the torso. Roll the casualty in a single unit. Place the casualty's arms at his or her sides. Casualty does not appear to be breathing. Step 3, open the airway using the head tilt chin lift method. Expose casualty's bare chest. Kneel at the level of the casualty's shoulders. Place one hand on casualty's forehead and apply firm backward pressure with palm to tilt head back. Place fingertips of other hand under bony part of lower jaw and lift, bringing chin forward. Do not use thumb to lift. Do not completely close casualty's mouth. Do not press deeply into soft tissue under chin. Step 4, check for breathing. While maintaining the open airway position, place an ear over the casualty's mouth and nose, looking toward the chest and stomach. Look for the chest to rise and fall. Listen for air escaping during exhalation. Feel for the flow of air on the side of your face. Count the number of respirations for 15 seconds. Casualty is not breathing. Step 5, insert an MPA. Keep the casualty in a face-up position. Select the appropriate size of airway by measuring from the patient's nostril to the earlobe or from the patient's nostril to the angle of the jaw. Lubricate the tube of the MPA. Push the tip of the casualty's nose upward gently. Push tube of MPA so that the bevel pointed end of the MPA faces toward the septum. Most MPAs are designed to be placed in the right nostril. Insert MPA into the nostril and advance it until the flange rests against the nostril. Never force the airway into the patient's nostril. If resistance is met, pull the tube out and attempt to insert it in the other nostril. Recheck breathing per step 4. Casualty is still not breathing. Step 6, give breaths to ensure an open airway. Insert a face shield if available into the casualty's mouth with the short airway portion over the top of the tongue and flatten the plastic sheet around the mouth. Maintain airway and gently pinch nose closed, covering the MPA using the hand on the casualty's forehead. Take a normal breath and place your mouth in an airtight seal around the casualty's mouth. Give 2 breaths, one each second, taking a breath between them while watching for the chest to rise and fall and listening and or feeling for air to escape during exhalation. Breaths should not be over-exaggerated or forceful. The chest did not rise. Reposition the casualty's head slightly farther backward and repeat the breaths. The chest still did not rise. Step 7, perform chest compressions to clear the airway. Kneel close to the side of the casualty's body. Locate the nipple line, placing the heel of one hand on the lower half of the sternum. Place the heel of the other hand on top of the first hand on the lower half of the breastbone, extending or interlacing the fingers. Straighten and lock the elbows with the shoulders directly above the hands. Without bending the elbows, rocking, or allowing the shoulders to sag, apply enough pressure to depress the breastbone 1.5 to 2 inches. Give compressions at a rate of 100 per minute, hard and fast at a ratio of 30 compressions to 2 breaths, with the intent of relieving the obstruction. Look in the mouth for objects between breath compressions and breaths. After 1 round of compressions and breaths, the grader will state, you see an object in the casualty's mouth. Remove the object. Step 8, reopen airway and repeat the breaths per steps 3 and 4. Grader will state, you see the chest rise and fall with your breaths, but the casualty is still not breathing. Step 9, check for a pulse for 5 to 10 seconds. Place tips of index and middle fingers in groove in casualty's throat beside the Adam's apple on the side closest to you. Do not use the thumb. Grader states you do not feel a pulse. Step 10, perform CPR. Position your hands and body for chest compressions as in step 7. Give 30 compressions. Press straight down to depress the breastbone 1.5 to 2 inches. Come straight up and completely release pressure on breastbone to allow chest to return to its normal position. The time allowed for release should equal the time required for compression. Give 30 compressions in about 23 seconds at a rate of 100 per minute. Do not remove the heel of your hand from the casualty's chest or reposition your hand between compressions. However, all pressure must be released from the chest cavity to allow for full chest wall expansion. Give 2 breaths. Open the casualty's airway. Give 2 breaths, 1 each second. Repeat steps 10A through C for 5 cycles or 2 minutes. After one properly performed cycle, the grader will state 2 minutes has elapsed. If the candidate does not perform the steps properly within 2 minutes, they will be a no-go. Reassess the casualty. Check for the return of pulse for 3 to 5 seconds. Grader will state you feel a pulse. Check for breathing for 3 to 5 seconds. Grader will state casualty is not breathing. Give breaths at the rate of 1 every 5 to 6 seconds. Breaths should not be over-exaggerated or forceful. After the candidate has demonstrated proper performance, grader will state 2 minutes has elapsed. Recheck for pulse and breathing. Grader will state the casualty is breathing and conscious. Step 11, place the casualty in the recovery position by rolling him or her as a single unit onto his or her side, placing the hand of his or her upper arm under his or her chin, and flexing his or her upper leg until help arrives. Watch the casualty closely for life-threatening conditions, maintain an open airway, and check for other injuries. Step 12, candidate will state that if the casualty's condition deteriorates, they will continue CPR until A, the breathing and pulse returns, B, they are relieved or stopped by qualified personnel, C, they are physically unable to continue.